Steve Klasko, reporting to you from the World Health Organization. It's January 2nd, 2030. A mutant strain of an RNA encapsulated virus has been afflicting people in Australia. Of course, people old enough to remember, especially healthcare workers, the dark, dark days of early 2020 and the COVID-19 crisis immediately panicked, but only for a second, and then they smiled. Because they knew healthcare had evolved from a broken, fragmented, expensive, inequitable sick care system to a health assurance system where most of their care happens at home. Since most of your healthcare data, obviously, is now continuously streamed to the cloud, and AI bots are constantly analyzing them for any changes, the early symptoms of this new virus were immediately identified. And anyone throughout the world who exhibited those early symptoms was immediately notified and asked to socially isolate. As you know, if needed, your employer was notified and asked for an excused absence. Software was immediately sent through the Internet of Things, what we now call the Internet of You, so your home 3D printer could begin to create masks for you and your family. Those who were having panic attacks, remembering the COVID-19 crisis of 2020, could immediately communicate with their bot psychiatrist, and if necessary, could immediately receive drone-delivered treatment or sleeping aids. There were no lines or concerns about food or supply storages for the same reasons. Humans are not needed as the fourth industrial revolution. Drones, AI, Internet of Things, or robotics have modified the entire supply chain, and there's no reason to congregate in crowded grocery stores or even hoard toilet paper as they did in 2020. The whole, quote, scare was over within a month as new bioprocessing techniques allowed us to develop very quick and customized vaccines. Instruction for K-12 students continued seamlessly as the United States had finally reached broadband in 100% of households by 2025. And just as healthcare at home was mainstream, so were creative ways of teaching in a variety of venues. A far cry from what we witnessed throughout the country during the COVID crisis of 2020. While not enough can be said about the frontline healthcare heroes throughout the country in hospitals and healthcare entities, data was scarce and not analyzed in a coordinated fashion. There were different strategies in different states, and in some cases, different counties of the same state. At Jefferson Health, we had gone from 50 telehealth visits a day to 4,000 a day, but many health systems did not have the bandwidth to even accomplish telehealth. And speaking of bandwidth, most public schools in major cities in the United States shut down for months as cities such as Philadelphia had a large percentage of their population without broadband or computers at home. In some ways, health assurance was clearly the difference between life and death over the decade. And I congratulate all of you that were part of this webinar in 2020 that helped contribute to that revolution.
Thank you, Dr. Klasko. This is Heidi Boyle at Intellis Worldwide. And that was Story Time with Dr. Klasko. He's going to be joining us as our keynote at our virtual event on June 9th and 10th. Well, he's going to be discussing the DNA changes in healthcare in the age of AI, population health, and our new COVID life. Thank you. We'll see you guys then.